Welcome back to Erik Bank's bolagsdagen, the 16th of March 2023. My name is Claes Palin and I'm an equity analyst at the bank. We will move forward with today's agenda, and the next company to present is OssDsign. And here to present the company, we have the company's CEO, Morten Henneveld. Very welcome.
Thank you very much.
The floor is yours, Morten.
Thank you very much, and thank you very much for having me again. As normal, when we do the presentation, the normal disclaimer. Just in case you don't know who we are an orthopedic company operating in the orthopedic industry. We're in two segments of that industry today. We essentially here to solve a problem because the current skeletal defects just lead to poor clinical outcomes, and that means high cost for society. So if we start with our cranial business, unfortunately, many cranioplasties end up because you have infection. So ultimately, in the literature, we see about 10% infection rates. Now, when it comes to bone graft, it's a different case. It's actually a degenerative disease. So as we get older, we get spinal instability. Ultimately, that leads to a high number of people not having what we call a fusion. So 1 in 5 patients actually not getting the right fusion rate. So what is it we are bringing to the table? Well, we are coming out with the next generation bone replacement products. So if we start on the left side, this is OssDsign's legacy product. It's our cranial PSI. I can actually see, I think it's a wrong presentation that has been uploaded, so I may go a little bit quickly on some of it. We've actually come out with 1.4% infection rate or in removal rate as a result of infection. That is by far the lowest in the marketplace. At the same time, in 2020, we acquired a company. We entered the bone graft business. This is a high margin, very scalable, targeted at standard procedures in the US. And here we have some extremely promising preclinical data. Essentially, we are comparing ourselves with the best drug currently on the market, which is called BMP2 or infused from Medtronic. And in that model, we showed a 90% fusion at 12 weeks and 100% fusion at 26 weeks. When we compare ourselves, or when we compare that preclinical data to other, what I would say, more comparable companies, synthetic bone graft companies, they only score somewhere in the range of 25 to 50%. So clearly, this is extremely strong preclinical data. We have lots of experience. We have people in the company that have worked 20, 25 years in this. This is the best preclinical data we've ever seen. That was also why we acquired Sirakoss. With that move, it also means that OssDsign is becoming a brand new company. We have a 5 times bigger sales potential right now, operating in a $3 billion market. Both the segments we're in are extremely attractive. They are the 2 fastest growing segments in the orthopedic industry. And they're both categorized by generally high gross profit. Of course, bone graft stands out with a gross margin typically at 90% or sometimes even north of 90%. If you don't know much about bone graft is actually used as a synthetic replacement of the patient's own bone, what we call autograft. And it's used widely in the orthopedic industry, essentially from head to toe. But as you can also see here, by far the biggest market is in spine. So for us, from a pure market perspective, it made a lot of sense to go into spine. As it happens, a lot of us in the company, in management, in the board, and particularly in our US sales force, actually have many more years of experience in spine and biologics than we do in cranial. So we know who the surgeons are, we know the dynamics of the market, we know who the competitors are and their products. So it was a very natural move for us to go into that space. We launched a strategy a couple of years ago called Ascend 25. And essentially, that strategy dictates where we want to play. And we see ourselves operating in CMF and orthobiologics and spine. So that is the focus. We've set 5 very clear priorities in the company that we are working with, extremely disciplined. And every month, every quarter, every year, we keep zooming more and more in of those. So this is the strategy that we operate with. I'll just go a little bit quickly because I can see it's a wrong presentation. But we just finished 2022. We came out extremely strong in the last quarter. We actually finished the full year with 80% growth. We've had 3 consecutive quarters of triple-digit growth, around 150% in the US. And we've had an extremely strong acceleration in the first full year of OssDsign Catalyst. It represented 38% of growth in Q3. It was the same in Q4. And for the full year, and bear in mind, this is the first full year we're actually selling Catalyst, it actually already represents 30% of sales. Now, with the gross margin I just talked about earlier between the 2 segments we are in, even though we don't report gross margins, I think it's fair to say that already 1 year in, Catalyst is now, from a gross contribution point of view, 50-50 together with cranial business. So it's gone extremely fast, and it's a fairly transformative process we've been going through, and it's gone extremely fast, as I said. In addition to that, we've also come out with a new product called OssDsign Catalyst. It's a smaller size, it's a 1 cc. And that's essentially targeting smaller procedures, but the strategic importance of having that product means that we now have a full size range. So when we go into hospitals asking for approvals, then we can say, well, we are actually here, we can replace one of your products 1-to-1, you can remove all the other sizes. We also came out with the first post-market safety report on OssDsign Catalyst. You know, when you're bringing to market a novel product, the very first question you get from surgeon, and it's the right question, which is it safe to use? Under FDA, you're actually not obliged to do post-market safety. We decide to do it voluntarily because we think it's going to be very meaningful, both to existing customers, but also to future customers. That report covered 511 units sold. Of those 511, we recorded 0% adverse events, and we reported 0% complication or device-related complications. So, of course, this report clearly supports a very strong safety profile on the product. And last but not least, with our clinical registry, Propel. As you know, we're running 2 different studies. We have our Top Fusion, which is our first-in-man study running in Hungary. That's 17 patients for 15 evaluable. At the same time, we also set up a clinical registry in the US. And that allows us to, 1, capture lots of patient data much faster than if you do it in a clinical trial. But it also gives you a very exact read of how the product is performing in a real life setting. Because in that registry, there are no inclusion or exclusion rules. It's all patients, it's high BMIs, it's smokers, it's all kind of procedures, all kind of demographics. So it gives you a very exact read. As you can also see, things are going extremely well in the US. Actually, this one with the updated Q4, it means that US is sitting now at 33 million. So each bar you see here is 12-month rolling sales. And for a long time, you know, I think we were growing fairly decent. We were growing steadily along the line with the company in the US. But as you can see in the last quarters and accelerated even with Q4, things are really going fast in the US. And it actually means that the incremental sales we've added in the US from in Q3 and in Q4, in absolute numbers, is the same amount that it took the company 5 years to get to since we entered back in 2017. So it tells you something about the very exponential momentum we're having right now in the US. So I think I'll skip some of these. In addition to all the great things we're doing on Catalyst, because that is, of course, a very high focus in the company right now, we also keep coming out with strong data on our cranial PSI. I mean, since the very first clinical study in 2018, we have had a market-leading removal rate due to infection, which has been consistently below 5%. And we now have more than 10 clinical and preclinical peer-reviewed publications on the product. In the fall, we had the largest US cohort, and in that, again, a zero rate of implant-related complications was recorded. Just after this was published, we actually came out with the biggest, or we didn't, but one of our customers in Germany came out with the biggest study to date of 82 patients over 7 years, measuring cranial PSI against something called PMMA, which is one of the technologies for plastic implants. And they actually concluded that this product seems to be superior to PMMA. So again, we keep adding to the growing body of evidence of strong data. Now, clinical is one of the areas where we have fundamentally changed the agenda, not only in terms of what we are doing, moving from pre-clinical into real clinical, but also really making some very meaningful investments in mid to long-term growth. And very much on cranials around the post-market surveillance. It is by far the best market surveillance data you have in the market, and it keeps getting confirmed every time we come out with a new report. For Catalyst, things are going extremely well. Our TOP FUSION completed enrollment in April. We already have our first patient at 1 year. That report was actually published early January, showing a full fusion rate at 6 months, and already at 3 months, we had progression to fusion. So that, even though it's only one patient, it confirms the potency of the product that we also saw in the preclinical data, that this product is not only able to generate a good fusion rate, it's actually able to generate it very fast. On Propel, we've had tremendous interest from institutions to work with us. We thought we set ourselves an ambitious target for the year. First patient was enrolled at the end of March, and already in November, we actually hit 100 patients in that registry. So again, extremely good momentum that we are having in the company. So if I'm just to summarize, I think 2022 was a tremendous year. I think we delivered on many things in the strategy. We created a lot of value into the company, also shareholder value going forward. And we entered 23 as a much stronger company with much greater scalability. Not least, if you look at our priority number 1, which is winning the US, that US is now 60% of the company. It's growing exponentially. The customer base in the US has grown a lot, and it's much more recurrent than what we've seen in the past. The second priority was to build a biologics business. That business ended up with 17 million for the full year, which I think is a very meaningful number to achieve in the first year. We've treated 500 patients, and we have a strategic advisory board with some very leading key opinion leaders acting as ambassadors for the product. So overall, we are on a very, very good track right now, growing more than we've ever been. And also the fundamentals to mid to long term are really, really coming together right now. So I think with that, I'll say thank you for the presentation, and hand back to you.
Thank you so much, Morten, for an interesting presentation of an interesting company. Let's start with the Catalyst, questions about that, and particularly the newly launched application of Catalyst, or if you could describe the differentiation compared to previous.
Yeah, I mean, I think when when you're launching a new product, the bone graft market is extremely crowded, right? There are many companies out there, but what we are seeing, of course, it's about the clinical data. In our case, we have strong preclinical data right now that is extremely meaningful. It resonates with surgeon. But the other one is what we call handling, and that's a little bit difficult to describe. But imagine a surgeon needs to take the bone graft and put it into the surgical site. To the extent that this product handles well, that is actually a key deciding factor for many surgeons. And actually, for the first time, I brought a product. So, bear with me. I'll just need to put on a glove, and then I'll try to demonstrate what it is. Because I think you have to imagine if you put it into a surgical site, then you really need to be able to mold the bone graft to get it into the places, that you really want. And what's also important is, and what we see with some of competitive products is, inevitably that bone graft product, which is this one, this is our 5cc, so the middle size we have, when that gets mixed with blood or the patient's own bone, there are numerous products out there that you kind of dissolves, and that's the only thing you don't want. You don't want the granules to spread out. They need to sit where they need to grow bone. So let me give you an example of one of the things that really sets the company apart. So this is actually the bone graft that is put in. Normally you do something we call a sausage, so you put like a strip and you put it on the vertebrae to get bone graft. I'll roll it in. You can see here, I don't know if you can see it on the screen. You can mold it. It's a little bit like what we know from kids with clay. So I'll roll it into a small bowl now, and I'll drop it in a glass of water. And just imagine now that this is mixed with blood. The one thing that is important here is that it doesn't dissolve, it doesn't spread. It needs to stay exactly where the surgeon is putting it. And as you can see, I don't know if you can see it on the screen or here in the room, it stays exactly where it is. This little feature with a glass of water is actually something we're doing with the surgeons, also during dinner. And this is creating a wow effect because they are not used to having a bone graft that sits together like this, even when it's mixed with liquid, whether it be blood or anything else of that nature. So the ability to actually mold it, put it into the surgical site, and having the confidence that even when it's mixed with a liquid or blood, that it stays like this is extremely meaningful to surgeons. And I would say in an early commercialization phase, probably even more important than actually having clinical data. So sorry, that was just a small demonstration, but as you can see, luckily it worked. Now we are trying to demonstrate it live for the first time.
And you are unique with this?
Yeah, I mean, everyone will say in the industry that they have good handling, and it's something that is extremely difficult to actually qualify, and that's also why it's very easy to say for many companies. I mean, there are even big sellers, $100 million companies in revenue that are notoriously known for having poor handling quality, where, for instance, you cannot do that. We had a meeting in Washington only last week and discussed this with the surgeon, and this actually came up. So there are many, I would say, good products out there, also products that have good clinical data that just doesn't work very well in the operating theater. And that means a lot to surgeons. It really means a lot. So, and as you can see here, I would say this is the wow factor we're getting on the product. As we are building the data, we have strong, what we, at least to our knowledge, is the best preclinical data that have ever been done on a synthetic bone graft. And then you show the handling qualities, which is just unanimously in every conversations we have coming back as a key feature of the product.
Very impressive.
Thank you.
The US market is the most important market for you. How is your presence in the US market currently?
Well, right now we are, I would say we are increasing. We have about 13, 14 people or so. You know, the US is, it's a direct sales, but in practice it's more of a hybrid, right? Because you're working with what in US terminology is called distributors. In practice, it's sales agents, it's commission-based. So what that means is that we can actually cover fairly large geographies because in each single hospital, there is a what we call a distributor or an agent associated to that hospital or that specific surgeon. So it means that once we open up, we work together with the local distributor, and then we can kind of move on, and he will take care of the day-to-day business. So even though we're only 13, because it's that hybrid, which is, by the way, the same for all orthopedic companies, that's the way the market works. It actually allows us to cover a fairly large space. Having said that, we have no aim of covering the entire US. We are very heavy, very focused on the East Coast, some of the southern states, Texas into California, and that's a big focus for us. The Midwestern state, we're not really that present, and we have no intention of doing that.
And you have been on the market for about a year, and I guess the customers you have, the surgeons that have started to use Catalyst today, could you describe what kind of how an early adapter looks like? Is it private clinics or is it hospitals, or where do you find them?
I would say it's very mixed, actually. A big part of the US is in private clinics or private settings. That also means that even in these times, and the markets are still very challenged with elective procedures down, and in particular, some very significant delays to the hospital approval processes because they have these fundamental challenges just operating the hospitals these days. I would say the bone graft business is more robust because a lot takes place in private settings, but I would say it's everywhere. It's the small community clinics, it's the very, very large centers, it's also some of the university hospitals. So I think there's quite a broad mix, actually. I think what's the common denominator is that they have all come on board for two reasons. That is the preclinical data and the handling I just showed.
Interesting. And for a surgeon that wants to switch to your product, do it need a lot of training and educational before?
No. I mean, this is the beauty. That's also why there are different ways you can solve these. You can solve it with synthetic bone graft. As we are selling, you can use what's called allograft, so donor-based products, or you can use a patient's own bone. Now, on the donor-based products, you may have heard there's been, again, more cases. There was a big tuberculosis case recently where 8 patients died and 135 got affected. So many surgeons are getting more conservative about using some of the donor-based products these days. So of course we are targeting the ones that we know, like the synthetic, like the safe choice of a synthetic, and that's what we target. It's fairly simple. As I said, we have more years of experience with spinal biologics actually than we do with cranial in the business. So we know who the surgeons are. We have relationship to some of those, which means that they pick up the phone when we call. And that, of course, has helped us getting a head start relative to a normal commercialization curve.
And when they start using Catalyst, do they test it on a couple of patients first and then?
Yeah, I mean, the normal is, if you just take the normal approval process, right, then you probably have to work on a surgeon for a couple of months just to get him on board. He needs to fund that product going into what's called VAC, so Value Analysis Committee, which is the hospital approval process. That used to take 3-4 months. Now it takes more like 6 to 9. And then he starts using it. But what he typically does is that he will do a handful of cases max. And then he will wait probably 2 to 4 weeks just to see that nothing bad happens. There are unfortunately cases in the US where biocomposites and strikers and others have had products they have to take on the market. Typically, it will show fairly quickly in terms of infection or swelling or things like that. So I would say anything within a month he would know. Once he feels comfortable about it, then he will start to use it. But, he may use it only for certain procedures in the beginning. And then when he's comfortable with that, then he expands the usage into more procedures. Then he talks to his partners in the hospital and say, are you aware of this? So that's kind of how you build up penetration within the accounts. But first hurdle is to get through the hospital approval processes, which is even more complicated these days. But of course, once you are in, which is also really where 2022 and 2023 is different for us, because 2022 was all about getting the approvals. Now we're coming into 23 with quite a meaningful amount of approvals. So of course we want to build those, but we also need to work on increasing the penetration where we're already approved. So, so that's kind of I would say a normal way of selling these products into the surgeons in the orthopedic industry.
Time is running away, but maybe you could describe what would be the most important goals to achieve in 2023, maybe for both your product categories.
Yeah. No, I mean, I think I got a question yesterday and I started laughing because we seem to be running on every single cylinder right now. But of course, there are things that are more important than others. I would say continuing on the catalyst, we're off to a very, very, very good start. And really riding on that wave and keep building and accelerating that growth is important. Then I would say all the effort and the strategic investments in mid to long term we are making into clinical, we have to follow through and keep executing well. We have done tremendously well in 2022, and I want to see that continuing, of course, into 23. And then I would say on our cranial business, we need to bring down that lead time. It is a prerequisite, in particular in the US, for really being able to capture more cases and being relevant for surgeons for many more of their cases than what we currently are. So to the extent that we can get that lead time, it is also one of the strategic priorities, but getting that lead time down certainly will set us up for a different prospect relative to growth, in particular in the US.
Okay. Thank you so much, Morten.
Thank you.
Thank you.
Thank you.